May is Mental Health Awareness Month, and all this week, we're doing stories on why mental health matters. In a 2012 report, the Department of Veterans Affairs estimated that 22 veterans die by suicide in the United States every day. Now, the number has fluctuated in recent years, but the key message is that suicide affects veterans at a higher rate than the general population. And as we've learned, it's a complicated problem to try and solve.
I wake up every single morning, and the first thought in my head is today the day? He was trying to fight it. He was trying to fight the demon, and the demon won.
Every veteran is different, every story is different, but for many of the men and women who have served in the armed forces, access to mental health services can often be the difference between life and death. Marine veteran Jimmy Craig knows that unfortunate truth all too well.
He was about 71 days out for an appointment.
One of his battle buddies reached out to him during a crisis, and it's a phone call he will never forget.
He called me back. I answered the phone. I said, "Hey, what's up, man?" And it was silence. Silence. He didn't say a word. And I said, "Well, as you need to, man. I'm right here." I could hear him. You know, he was struggling.
The friend said he would call again the next day.
And then right before the phone went dead, I heard it.
Jimmy would never get that call because the sound he heard was a gunshot.
Anybody that's been in combat, that's been wounded in combat, blown up, shot, whatever, has the physical issues. Those get dealt with just like anybody else going to the doctor. But the mental health part of it needs to be a focus.
Here at the Chalmers P. Wiley Veterans Facility in Columbus, a team of behavioral health experts provide services such as mental health rehabilitation, crisis intervention, and suicide prevention.
But I think for a lot of veterans, it still is difficult to walk in and say, I need help for mental health issues.
Dr. Heather Robinson is the director of the Trauma and Recovery Division at the VA. She's also a veteran.
I would say the veterans that have served during wartime, they saw things that we typically are not built to see. And they have to live with that for the rest of their life.
Dr. Robinson says there is a critical need for mental health care and for doctors with military experience to work with these veterans.
Veteran providers, we do understand the military culture. Something as simple as the acronyms that the military uses, the risk that you assumed by just saying I'm going to be in the military. And that does help bring some trust.
She says help is available, but often the biggest hurdle is getting that veteran to seek it out.
It's not a weakness. It really takes a lot of strength to walk into this facility or into my office and say, I need help. I'm not managing things well.
Dr. Robinson admits it can take up to 2 weeks or more to get an appointment with one of their psychologists for continued treatment.
It's a huge, complicated system, and it's a huge, complicated problem.
Marine veteran Cole Lyle is the executive director of Mission Roll Call, a movement giving veterans a voice on issues important to them like health care and benefits. But their number one priority is suicide prevention.
It could be service-connected. It could be acute stress from financial issues or relationship issues, or a conglomeration of all those things.
Lyle believes veteran suicide is more of an outreach and education problem than anything else. Of the 18 million veterans in this country, he says only 9 million of them engage with the VA.
We know that veterans who are engaged with VA or community resources are less likely to take their own lives. So getting that information and getting those resources out there to veterans is a big deal. And to be honest, not every VA does a great job of outreach.
And suicidal thoughts
Absolutely.
are something Jimmy can relate
Absolutely.
to.
It's the very first thing I think of in the morning is today the day I make everything stop.
Living can be much harder for war veterans like Jimmy, who suffer from PTSD.
Night terrors. Every night, same dream. The loss of our friends, the guys that you don't see anymore. It's a lot of it's survivor issues. You know, why them?
And living with a veteran can also be difficult for their spouse. Libby Craig watches Jimmy suffer in silence, not really knowing how to help him.
It's hard, but I have to be that sounding board for him. I have to listen. I have to help. I have to be patient. It's hard, but we're a team.
Come on, come here.
She says they have good days, bad days, and worse days. And although the suicidal thoughts are concerning,
It's a challenge. You got to figure out a way to not shoot yourself.
Libby believes her husband is strong. He's still here and still trying to help other veterans.
They have to find each other. And the combat guys seem to, they've been through it. It doesn't have to be the same combat fight, but in general, combat is combat.
According to data released by the VA last fall, veteran suicides fell to their lowest level in 12 years in 2019. The average reported that year was 17. But again, that number only includes deaths the VA was made aware of. Remember, if you are having suicidal thoughts, there is help. You can call the National Suicide Prevention Lifeline at 1-800-273-8255. And we've also put a list of veteran support services with this story on our website. Just go to 10tv.com.